Okay, good morning, everyone. This webinar offers closed captioning. To enable closed captioning, click on the blue widget or the CC icon in a box located either at the bottom or top of your screen. Welcome to the Chicago Vaccine Requirements webinar. This webinar is being recorded and will be available at youtube.com/ChicagoBACP. And finally, please use the chat box located on the bottom right of your screen to send questions. There will be a Q&A session at the end of today's presentation. Today's agenda will cover an overview of health metrics, the Chicago vaccine requirements, and information for businesses. I'll now welcome Dr. Erica Taylor with the Chicago Department of Public Health. Dr. Erica Taylor.
Hi, good morning. Dr. Erica Taylor, Medical Director at Chicago Department of Public Health, and just happy to be here with you this afternoon. So I'll just present on some of the current statistics going on in here in our city. So we're definitely seeing an inundation of cases over the last few weeks. For the current week, this is updated on a day-to-day basis. Our COVID dashboard, we're seeing roughly 3,825 cases daily, and that's up 63% from last week this time. In regards to hospitalizations, that's also increasing at roughly 90 per day. And then deaths, we're also seeing an increase in that area with roughly 10 per day. Vaccinations are 9,564 per day. And then we're testing about 29,418 daily. There does seem to be a lack of supply of tests just throughout the nation. And then in regards to our positivity rate, it's almost double compared to last week. So we're currently at a 16.2% positivity rate. So Omicron is here, and it's thought that it's currently attributing to roughly over 50% of the cases that we're seeing here. And so this is one of the reasons why we are really encouraging individuals to get vaccinated and boosted when it's time. Next slide, please. In regards to looking at COVID cases, we're actually seeing more cases in individuals who are unvaccinated compared to fully vaccinated Chicagoans. Since the week of Thanksgiving, the infections are 3 times as likely to occur in unvaccinated Chicagoans. And so you can see here this peak here versus the fully vaccinated down here in blue. Next slide, please. Someone stated they can't see the slides. In regards to hospitalization rates, we're also seeing more individuals who are unvaccinated compared to fully vaccinated Chicagoans who are being hospitalized. That's again occurring at a 5-fold rate, and we've seen a rapid uptick since Thanksgiving, and we're likely to continue to see that increase with our recent round of holidays. We're also starting to face some issues with hospital capacity, and so in the upcoming weeks, there may be issues where hospitals are approaching less capacity to house the individuals that are sick. Next slide, please. In regards to death rates, they're also higher in unvaccinated individuals compared to fully vaccinated. Since the week of Thanksgiving, we have seen a 5-fold increase in deaths in individuals that are unvaccinated. So again, our message is that the best tools that we have in our toolbox are to get vaccinated and boosted. So any individual over the age of 16 is eligible for boosting. Next slide, please. Where can I get vaccinated? So vaccines are widely available. You can reach out to your local pharmacy, your healthcare provider. There is also an at-home program that will come out to your home if you call, and they will actually vaccinate up to 10 individuals. Community events, the City of Chicago vaccine sites, Chicago Public Schools, and ZocDoc. You can also call 312-746-4835. to be vaccinated. So what does it mean to be fully vaccinated against COVID-19? People are considered to be fully vaccinated if they are 2 weeks out after their second dose in a 2-dose series of either Pfizer or Moderna, or at least 2 weeks have passed after a single dose of the Johnson & Johnson vaccine. If you don't meet these requirements, regardless of your age, you are not considered to be fully vaccinated. Next slide, please. I'll now turn it over to Miguel.
Good morning. My name is Miguel Campo. I'm a supervisor with the City of Chicago Department of Business Affairs and Consumer Protection. Before we get started, we are aware that there are some individuals who are having issues seeing the slides. There might be a slight delay. As stated at the beginning of the webinar, this is being recorded. So if you are unable to see the slides, you can always go back and watch the webinar on our YouTube channel. I know many of you are going to have questions. We are going to have a Q&A session at the end of the presentation. If we are unable to get to your question today, feel free to send an email to bacpoutreach@cityofchicago.org. That email will be on the bottom of the remaining slides of this presentation. So once again, bacpoutreach@cityofchicago.org. At the moment, we have over 160 attendees, so we might get hundreds of questions during the presentation. So we will try our best to try to get to as many as we can today. So the reason we are here today, given this presentation, is to go over the Chicago vaccine requirement. So effective January 3rd, which is this coming Monday, Chicago Public Health Order 2021-2, hereby known as proof of vaccination in public places, will go into effect. Any individual that is 5 years of age or older will be required to show proof that they are fully vaccinated against COVID-19 to dine indoors, visit gyms, or entertainment venues where food or drinks are being served. Individuals under the age of 5 may enter Chicago vaccine requirement establishments without displaying their proof of vaccination, as long as they wear a face mask, except when they are actively eating or drinking. Children ages 2 and under are not required to wear a mask. The public health order will remain in effect until the city So the public health order will remain in effect until the city is through the Omicron-driven surge and the risk of overwhelming our hospital system capacity has passed. I do want to reiterate that that is the main point of instituting this vaccine requirement, is that we want people to get vaccinated and we do not want to overwhelm our hospital systems. Next slide, please. So the Chicago vaccine requirement. So these graphics are available by visiting Chicago.gov/COVID. The one on the left, Chicago vaccine requirement. Starting January 3rd, the city of Chicago will require proof of COVID-19 vaccination for certain indoor public spaces. A valid form of verification includes a valid photo ID for those that are 16 and older, and then either a vaccination card, a photocopy of the vaccination card, a digital record or app, or a printed record from the vaccine provider. So again, beginning January 3rd, proof of vaccination will be required for certain indoor public spaces. That is going to include indoor dining, indoor fitness, and indoor entertainment and recreation venues where food or beverages are being served. And I'll go into detail as to what falls within those 3 subcategories on the next slides. So what types of entities are required to ask for proof of vaccination? So indoor dining, which are establishments where food or beverages are served. This includes, but it's not limited to, a restaurant, a bar, a fast food establishment, a coffee shop, a tasting room, a cafeteria, a food court, a dining area of a grocery store, a brewery, a winery, distillery, banquet halls, and hotel ballrooms. Next slide, please. So indoor fitness venue. So this includes, but is not limited to, a gym, a recreation facility, a fitness center, a yoga center, a Pilates center, cycling, barre and dance studios, a hotel gym, a boxing and kickboxing gym, a fitness boot camp, or any other facility that is used for conducting indoor group fitness practice. A question that we've gotten a lot already, and I'll go ahead and get out of the way now, is are individuals allowed to use the locker room to change clothes without showing proof of vaccination? Our answer is no. Indoor fitness venues must comply with the Chicago vaccine requirement policy. Next slide, please. And I also mentioned indoor entertainment and recreation venues where food or beverages are being served. These types of venues include a movie theater, a music or concert venue, a live performance venue, an adult entertainment venue, any commercial event or party venues, a sports arena, a performing arts theater, a bowling alley, an arcade room, a card room, a family entertainment center, play areas, bowl and billiard halls, and other recreational game centers. The main thing to remember here is that this only includes recreation or entertainment venues where food and beverages are being served. Next slide, please. So in addition, another component of the vaccine requirement is that a covered entity, which would be any business that would fall within the three categories that you described, must comply with OSHA standards 1910.501E and G relating to employee vaccination status and testing, regardless of the number of employees that you have. So again, if you're a covered entity, you must comply with current OSHA standards. Essentially, your employees working in these covered areas must either be vaccinated or submit to weekly testing. Details can be found at the OSHA website, which we will put up on our last slide for you to go and view the OSHA standard regulations. Next slide, please. So the city's order, which requires proof of vaccination in public places, does not include the below. So these are exceptions. So a house of worship, a grocery store. This would not include an indoor dining section in the grocery store. Any location inside either O'Hare or Midway International Airports, any K through 12 public or private school, so that covers elementary schools and high schools, and any daycares. The vaccine requirement does not apply to a location in a residential or an office building, the use of which is limited to residents, owners, or tenants of that building. So for example, a fitness center that is located in a residential condo building does not need to abide by the vaccine requirement. And the vaccine requirement does not apply to any food service establishment that provides any charitable food services, for example, a soup kitchen. So in addition to the examples of exceptions that I've provided, the following individuals are also exempted. So we covered locations. Now we're going to cover individuals who would be exempted from the city's order and do not need to provide proof of vaccination. So any individual entering an establishment for less than 10 minutes to order or carry out food, make a delivery, or use the bathroom. So for those of you who are on today's webinar, who are operators or owners of a fast food establishment, anyone going in to make an order, to take home, to take out would not have to abide by the vaccine requirements. So you do not need to check the vaccination status of these individuals. The same would apply to any delivery drivers, whether they're delivery drivers of the establishment or picking up food for Grubhub or Uber Eats or DoorDash or entities of that type. So any non-resident performing artists and accompanying non-residents who do not regularly perform or render services at the covered location. So if you are the operator of a music venue and the performing artist does not reside in the city, you do not need to check the vaccination status for the performing artist or any accompanying non-residents. So people who set up equipment for a musical act. I'm using musical acts as an example. So if you are a performance arts venue and you have a cast coming in to perform a play, any staff associated with the production of that play who are coming in from out of town would not have to show vaccination status. The same applies to a non-resident professional athlete and any accompanying non-residents who enter the covered location as part of their regular employment for purposes of that professional athlete or sports team. So anyone entering the United Center, Wintrust Arena, whether you are part of a traveling basketball team, hockey team, etc., the out-of-town non-resident professional athletes would not have to provide proof of their vaccination status. Any individual who has previously received a medical or religious exemption, provided that the patron must provide the covered entity proof of their medical or religious exemption and a COVID-19 test that has been administered by a medical professional within the past 72 hours prior to entering the covered location. Then any individual that is 18 years of age or younger that is participating in an activity that is organized by a school or an after-school program. So any high school or elementary soccer team, volleyball team, basketball team, anyone under the age of 18 that is participating in a school organized event would not have to provide their proof of vaccination in order to participate in said event. And then finally, any individual that is voting in a municipal, state, or federal election, or pursuant to federal law, anyone who is assisting or accompanying said voter in said election. What types of food service establishments are not required to comply with the vaccine requirement? If an establishment offers only takeout, delivery, or outdoor dining, and any indoor tables, chairs, or other furnishings normally used by patrons for indoor dining are removed or blocked, then they do not need to abide by the vaccine requirement. So if you are the operator of a fast food restaurant, a fast food establishment, common examples might be a Burger King or a McDonald's or a Subway or Popeyes. If you do not offer indoor dining, then there is no need for you to be checking vaccination status of your patrons as they come in. Next slide, please. So I've mentioned the phrase indoor dining a lot during the presentation. So does the order apply to outdoor dining instructions? It does not. So the order only applies to any part of a covered location with a roof or overhang that is enclosed on at least 3 sides. The order does not cover any temporary outdoor structures for multiple parties that have at least 50% of their sides open to allow airflow, nor dining structures for individual parties, such as plastic domes, provided that the individual dining structures have adequate ventilation to allow air circulation. So any location that is licensed as an outdoor patio, we've offered expanded outdoor dining options to restaurateurs and bars. Those locations would be considered outdoor dining and as such would not fall under the vaccine requirement. Common question that we've received a lot already is who must comply with the vaccine requirement policy when a covered premise is being rented out for a wedding or other event. So commercial event and party venues, as well as hotel meeting and event spaces must comply with the vaccine requirement policy if food and beverage is being served. A covered entity may, in the interest of efficiency, allow patrons to provide the requisite proof prior to entry, either directly to the entity or through an intermediary such as an event planner. So essentially, we're giving these types of businesses the option. They can either choose to enforce and follow the vaccine requirement themselves, or they can entrust that onto an event planner, a wedding planner, a promoter, people of that ilk. So are individuals allowed to use the bathroom without showing proof of vaccination? Our answer is yes. Customers and patrons that are entering an establishment just to use the bathroom would not need to show proof of vaccination. However, they are still required to wear a face mask. Next slide. So the business requirements for this new health order 2021-02, which again goes into effect this coming Monday, January 3rd. Each covered entity shall develop and keep a written record describing the protocol for implementing and enforcing the requirement of this order. Such written record shall be available for inspection upon request to any city official authorized to enforce this order. This order can be enforced by members of the Chicago Police Department, the Chicago Department of Public Health, the Chicago Department of Buildings, and then finally, Business Affairs and Consumer Protection. All covered entities must also prominently post signage at each publicly accessible entrance to the cover location and at least one location inside the cover location that is conspicuously visible, informing patrons of the full vaccination requirements. These are two examples of signs that we have that are available by visiting Chicago.gov/COVID. So vaccination and mask required. And then there's a second sign for vaccination and mask required in this section. Some of you may be operating a business that has an indoor component and an outdoor component to your business. So the second sign would cover the indoor portion, and then obviously any section that's considered to be outdoor dining would not need to comply with the vaccine requirement. Again, these signs are available at Chicago.gov/COVID for you to download, for you to print. There is a symbol on the right-hand corner that you can point your phone camera at, and it'll take you to the link as well as you post these signs up. These signs are available in languages other than English at the same website that I mentioned. So some of you were asking for examples or tips on how to comply with the written component section of the health order. So those are also available at Chicago.gov/COVID. So there are two documents there that you can look at. One would be a proof of vaccination policy for your employees, so a vaccination compliance plan. And then there's a second document that has tips on how to comply with Section 3. So there are tips just and reminders. So covered entities are not expected or required to maintain copies of a patron's CDC vaccination records. And then there are suggestions on how you can create a protocol. There's also a sample that can be modified to meet the needs of your specific business. So I know that there was several types of businesses asking for guidance on this. So there's a document with tips, and then a sample of a written protocol that you can utilize if you so wish. It's hard to provide a sample of a one-size-fits-all. There are several different dozens types of business entities that would be affected by or are going to be affected by the vaccination mandate. So there is not one like catch-all or one-size-fits-all. That being said, I would now like to take a few minutes to remind everyone that in addition to the vaccination mandate, the mask mandate is still in effect. It's been in effect since August 20th of 2021 for any indoor location within the city of Chicago. So face coverings must be worn in all indoor settings, regardless of your vaccination status, except when you are actively eating or drinking at a restaurant, bar, or similar eating establishment. Masks may be removed for specific personal service activities, which may require their removal. Examples of these are a beard, shave, or a facial. And then employees in settings that are not open to the general public a mask can be removed in those settings. So for example, if employees are static and maintaining at least 6 feet of social distancing from each other, such as cubicles and office space. Next slide. So again, the mask mandate only applies for indoor settings. So just to quickly cover typical or commonly seen outdoor settings, these include an open air stadium, such as Wrigley Field, Guaranteed Rate Field, Soldier Field, any park, a parking lot, a sidewalk cafe. We do allow sidewalk cafes to operate year-round now, an outdoor patio, and an expanded outdoor dining area, which I mentioned a few slides ago, any rooftops or areas with a retractable roof, an outdoor tent where at least 50% of the sites are open, igloos and other one-party enclosures, then any indoor space where 50% or more of a wall can be removed. Yeah, the opening of windows, doors, or panels is considered outdoor setting as long as those tables are within 8 feet of said openings. Next slide, please. Common indoor settings with regards to the mask mandate include commercial and residential buildings, hotel, recreation centers such as bowling or arcade rooms, a museum, a personal service establishment such as a massage establishment or a nail salon, any retail stores, a performance venue, including movie theaters, a hospital. And then as a reminder, masks must be worn on public transportation, which includes taxis, ride-hail liveries, private limousines, Ubers, Lyfts, as well as public transportation. In our essence, would include CTA buses and our CTA trains. Next slide, please. So the mask mandate, businesses are required to ensure customers and employees are adhering to the face covering mandate, and they must notify their customers prior to entry of the face cover mandate. These signs are also available at Chicago.gov/COVID. We are trying to have a one-stop shop for signage and matters relating to both current health orders. Next slide, please. So the following guidance is not being updated. We are not placing any capacity restrictions on any business. We are not instituting any social distancing requirements on any business. We are not limiting hours of operation on any businesses. Many of you have already dealt with additional restrictions that were in place throughout the past 20 months now. So our hope is that by instituting this vaccine requirement in conjunction with the masking mandate, that we do not need to revert back and go back to placing capacity restrictions, whether it's 25, 50, or 60%, social distancing requirement, directional lane markers and grocery stores, having a curfew again, limiting liquor sale hours. So our hope is to not reach those levels again. Again, the main reason that the vaccine mandate has been instituted is to try to convince people to get vaccinated. We feel that that is the quickest way to lift existing business restrictions that are in place, and perhaps more importantly, not overwhelming our hospital systems. Next slide, please. So we will now get to our question and answer section. Max, who's the host of the webinar, will read or go through the chat and we will try to answer as many questions as we can. Again, this webinar is being recorded. You can go back to it and go watch it at a later time by visiting youtube.com/ChicagoBACP. If we do not get to your question, or perhaps your question has already been answered as I move through the slides, if we do not get to your question, feel free to send an email to bacpoutreach@cityofchicago.org. It is on the bottom of the slide. Our staff will do their best to answer any questions. Before we get to what I'm assuming are the hundreds of questions that have been asked, I'll try to get ahead of the curve and answer some general questions that we've gotten already. So hopefully this answers some of the questions that you've typed in already. So again, how long will the requirement remain in effect? It's going to remain in effect until the city is through this Omicron-driven surge and the risk of overwhelming hospital capacity has passed. We've gotten multiple questions as to what is considered to be fully vaccinated. As stated by Dr. Taylor at the beginning, people are considered to be fully vaccinated 2 weeks after their second dose in a 2-dose series, such as Pfizer or Moderna, or 2 weeks after a single dose vaccine, such as Johnson & Johnson. The CDC's COVID-19 vaccination record card counts as proof of you being fully vaccinated. We've gotten questions regarding proof of vaccination from another country. Those are also valid. And again, anyone ages 5 or older will be required to show proof that they are fully vaccinated as of Monday, January 3rd, 2022. Again, people under the age of 5 are eligible to enter establishments as long as they're wearing a mask. We've covered indoor dining, indoor fitness, and indoor entertainment and recreational venues. What falls underneath that? Many of you are business operators, managers, or owners. Is proof of vaccination required for employees? Is a question that we get a lot. So while proof of vaccination is not required for employees, a weekly negative COVID test and wearing masks when interacting with patrons is mandatory. And again, we urge all of you to follow OSHA standards 1910.501, in particular subsections E and G. Again, some of you may have come in late into the webinar. A house of worship is not required to follow the vaccine mandate. A grocery store, however, if there's an indoor dining section, that area of the grocery store would have to abide by the vaccine mandate. Any location in either of our international airports, O'Hare or Midway, do not need to require proof of vaccination. The same applies to any elementary or high school, whether it's private or public, as well as daycares. So I will get to your particular questions that you may have now. In addition to the proof of vaccination compliance plan for employees that I mentioned earlier, and guidance on how to collect or have a written protocol in place, there is also a frequently asked questions or FAQ available at Chicago.gov/COVID. I'll now turn things over to Max, who will go through questions and either direct them at myself, answer them himself, or if need be, ask Dr. Taylor for an answer.
Thanks, Miguel. So I see a couple questions. I'll read them as Miguel said, direct them to either Miguel or Dr. Taylor. So I saw a couple of questions regarding what is considered proof of a religious exemption. How does one prove they practice a religion and are thus exempt? Maybe Dr. Taylor, do you want to get that one?
Actually, I will have to circle back with that in regards to information. I think that's something that our legal department really delineates, so I can circle back with you in regards to that response.
Another question here is, so at a university, our food vendor packs all food to go. Our students carry their food throughout the university in the classrooms, taking it wherever they are. Our students also bring packed lunches from home. Is this use exempt? Miguel?
So if you have a cafeteria, this is going to be a multi-layered answer. So obviously, if you are simply providing a prepackaged lunch and then students move around and they're sitting in the lobby or a classroom or study hall, then the vaccine requirement would not apply in those areas. It would apply to areas that are specifically utilized for food service. So if you have an everyday cafeteria or a food court where there are perhaps 5 or 6 or 7 restaurant establishments providing food, and there's an on-site dining area, it would apply for that specific area, but we are not asking you to check vaccination status of all your students as they move throughout the university property.
Miguel, how about if a restaurant is only operating as a carry-out restaurant, so no in-house seating? How would these rules apply to that establishment?
So the checking of vaccination status would not apply to this type of business, and I did mention in the webinar. So if you decide to temporarily turn your business into a takeout or delivery only, you do not need to have someone at the front door checking vaccination status for people as they come in to place an order, to pick up an order.
Would the OSHA standards still apply?
Yes, the OSHA standards would still apply. And again, I will add it on to the chat portion of it. I'll put the website for the OSHA regulations and standards. But yes, in essence, your employees would still have to be either fully vaccinated or be following a weekly testing protocol.
And on the weekly testing protocol, to be clear, the cost of those tests are not covered by the city. Looking at other questions. So here's a question on enforcement, Miguel. If the restaurant or the covered location is complying, is checking vaccination cards, but there is an individual, a patron that is not complying, who gets fined, who gets cited?
So to begin with, I just typed in the OSHA standards and regulations 1910.501 into our chat. So from an enforcement standpoint, we are simply asking you to check the vaccination status. Obviously, unruly patrons are going to attempt to disrupt your business activities. So if you have a written protocol and you're following it, and we show up and you tell us, here's a written protocol, this is what's going on. We observed you checking vaccination records. In that instance, we would not issue enforcement. And as has been the case throughout the pandemic, we are asking you to not place yourselves in harm's way. If you have someone that does not want to cooperate, by all means, feel free to call 911 and involve your local police district.
And regarding signage, can businesses for their own branding purposes, for instance, use their own signage instead of the city's vaccination signage, as long as the content is the same?
Yes, so for both the masking mandate and the vaccination mandate, you are free to make your own signage if you want to follow a specific style, decor, or branding with your establishment. Feel free to make your own. The city's is simply providing samples and some businesses do find them useful.
And are covered locations required to keep a record of vaccination status, or are they simply just checking at the door?
That will be up to you on a case-by-case basis. There is no requirement that you keep a copy of someone's vaccination record, whether it's like you taking a photo as people walk in of vaccination records or ID. Some of you might have resources to implement a pre-checking system. So if you are a hotel with a large wedding or private event space aspect to your business, you might be able to set up a website where a wedding planner can pre-check all of this information prior to entry into the event. It's not a requirement that you keep them, and there are an endless number of possibilities in which you can adhere to the written protocol.
Here's a question. Can you confirm that an employee cafeteria not open to the public is exempt from this vaccine requirement?
Yes. So I would use the example of a hotel. So if you are a hotel with hundreds of associates or employees working on a daily basis, any area that is not open to the general public, whether it's an employee break room or cafeteria, would be exempt from the vaccination status. And again, the same would apply to like a fitness center that might be employees only. Some of you may not be a hotel and you're in an office setting and you provide auxiliary services to your employees, such as a gym. You would not need to check vaccination status in those types of private locations.
If you have a business in which some areas that are covered by the mandate, but others aren't, is the entire business subject to the vaccine requirement?
No. So again, we'll utilize a hotel example again. That seems to fit this question again. So if you're a hotel, the covered areas of the hotel that would apply would be like a dining setting, a restaurant, a bar, and then the fitness center or gym within the hotel. The rest of the hotel space would not have to abide by the vaccination requirement. So a lobby area, guest entering a room or staying as guests would not have to, you would not have to check the vaccination status of those guests. So it would not apply to all areas of the business. And that's another one of the reasons that we provided signage that says vaccine requirement is in play for this specific area.
If you're a restaurant with both indoor and outdoor seating areas, how does the vaccine requirement versus the mask mandate apply to those indoor and outdoor seating areas at a restaurant?
So the outdoor seating section of the restaurant would not have to abide by either the masking mandate or the vaccine requirement. However, the indoor section would need to abide by both the masking mandate and the vaccine requirement. Which, again, going back to signage available at Chicago.gov/COVID, that's why we made signs saying like the vaccine requirements in effect in this specific area. So it only applies for indoor settings, the vaccine requirement. And then the masking mandate also only applies to any area that is considered to be an indoor setting.
And regarding the OSHA requirements, do employees only in the covered location portion of a larger business have to comply, or is it all employees across that larger business space or premises, even areas that are not covered locations?
The quick answer to that question is going to depend on the number of employees that you have. OSHA regulations currently state that if you have 100 or more employees, then the regulations apply across the board to every single employee. If you have less than 100 employees, then the Health Order 2021-02 would only apply to the employees working within the covered locations. So let's say, again, we'll use the example of a hotel. Let's say you're a hotel with 80 employees, 10 of which work in a restaurant that's located within the hotel. Only the 10 employees working in the restaurant section in that scenario would have to abide by the OSHA regulations. The remainder of the staff or personnel would not.
In a meeting room at a hotel, if you have a complimentary water station but no other food or coffee service, does that establishment need to provide for proof of vaccination upon entry?
My initial answer is going to be yes. If whoever sent that question can send an email to BACP Outreach, we will double check with our colleagues at the law department. But essentially, yes, if you're offering complimentary coffee service, patrons utilizing that service or entering the area where the coffee service is being provided would have to be fully vaccinated to participate in that or take advantage of that service.
If we use a third-party event planner to gather vaccination status prior to a meeting or event, what documentation should the business require from that event planner to ensure compliance?
We are leaving that up to the discretion of the individual businesses. So, for example, part of your written protocol can be I hired company XYZ to complete vaccination verification process, and then prior to the event, the vendor can give you a list with these are the 100 people who are attending the event, and then these are their names, and then these are their vaccination status, whether they're fully vaccinated, yes or no, and then that would suffice from our end. We don't want to sit here and regulate or over-regulate and tell you exactly how that process should work. It might be a trial and error type of issue, and obviously that specific example would not fit many of you. So many of you cannot afford to hire a third-party company to do a pre-check prior to an event. Some of you can afford to do that. Some of you might find it easier to have some of your own staff members just do it the day of at the door. That'll be less time consuming and less resource driven. But again, that is one of the reasons that we did not want to sort of publish a one size fits all template or sample that would be utilized for every business. If you are a gym or a fitness center, what works for you may not necessarily work for a corner bar, a neighborhood bar, things of that sort.
In regard to the OSHA requirement, what are acceptable types of tests for unvaccinated employees at home, administered by a medical professional, et cetera?
I will repost the link to the OSHA requirements again. They go into detail as to what is an acceptable or not acceptable test. To quickly answer the question, individual at-home test that's done by your employee would not meet the OSHA requirements. It would have to be done by a medical professional. And that could include like a telehealth visit. But again, Particular details are located within the OSHA regulations, and for prosperity purposes, I will retype that into the chat.
And Dr. Taylor, can you tell us about the availability of testing in the city of Chicago right now? What kind of testing options are there?
So in regards to testing options, you can reach out to that number, the 312, I don't have that number here in front of me here, 312743 number for the city of Chicago, 3245, in regards to testing opportunities, as well as going to the city of Chicago website to see what testing modalities are available. There are also standalone centers that are also out there that are offering free COVID testing as well. There does seem to be a limited supply chain of the rapid testing at this point.
I reposted the link to the OSHA standards, and again, many of your OSHA specific questions, the answers are contained within the document. I know some of you have questions regarding like PCR testing versus antigen testing, or like at-home testing or telehealth testing. The OSHA regulations contain more detailed answers to those questions.
Miguel, are museums and galleries exempt from the vaccination mandate?
For the most part, yes. Again, unless there is a food or beverage component to the museum or gallery. And then in that case, the vaccine requirement would apply to those subsections. So if there is a food court inside a museum, it would apply there. But in general, for general admission into the museum or art gallery, you would not need to check vaccination status.
And how would you, Miguel, classify a conference center? Same question, exempt or not?
It'll be similar to the answer I gave for the museum. So it's going to depend on whether there's a food or beverage component that's being offered in conjunction with the hosting at the conference center. So if you are hosting a conference and you are providing a training class, or you have speakers, if you're providing lunch or beverages, then there would be a vaccination check or status requirement for that. But if there is no food or beverage component with the hosting of the conference event, then the vaccination requirement would not apply. And then again, just as a reminder, the masking mandate for indoor spaces is still in effect. It's still in effect. The vaccine requirement is not superseded or negated. Both would have to be followed. So for the last couple of questions, the museum and art gallery, and then the conference center, while you may not have to check vaccination status, the masking mandate is still in effect for any indoor component of those businesses.
In regards to fitness programs, is there any distinction between those fitness programs that would cater to participants that are children versus participants that are adults? And does the teacher of the fitness program have to also be vaccinated?
This is going to depend on the origin or the organizer of said event. So if it is a school organized event being led by school faculty. So boys or girls, indoor volleyball, a soccer tournament, like basketball game, volleyball, swimming classes being held on school grounds, being led by staff that works at the school, whether it's a coach or a teacher, then the vaccine requirement would not apply. If you are a venue that is providing practice space for like a traveling club team, and then in that case, it would apply to both the employees, coaches, organizers, and the children who are participating in the event. So the exception to the vaccine requirement only applies to school-led or school-organized events. If you on your own are deciding to take your children to a swimming center, then in order for them to participate or be inside the swimming center, they would have to be fully vaccinated if they are 5 years or older.
And in regards again to an establishment that allows patrons to bring their own food and drink into the premises, what would be the status of that establishment that otherwise does not serve food?
It would depend on whether you meet one of the other two categories. So if you are a bring your own food or bring your own beverage establishment that you're entering a fitness center, then obviously the fitness center portion would override it. So it's really going to depend on your original business activity, what you're doing, and whether you might meet the definition of a covered entity via one of the other sections that's not necessarily a food or beverage center. So I know we covered the example of the university students bringing in their own food from lunch and then eating in hallways or libraries or meeting rooms, etc. It would not apply there, but for example, if you are a fitness center or a boot camp offering fitness boot camps, the vaccine requirement applies to you regardless of whether people are bringing in protein shakes or meals to replenish themselves afterwards.
So it is now the top of the hour, 12 noon. I see there are still a number of questions in the chat, though, as Miguel said, as we end here, please do send your questions to bacpoutreach@cityofchicago.com, cityofchicago.org if they were not answered in this webinar today. Also, on this last slide, you'll see a number of important links: the vaccine finder, Chicago.gov/vaxfinder, the mask mandate, Chicago.gov/COVID, the vaccine requirement, also at Chicago.gov/COVID, and webinars, including recordings, at youtube.com/ChicagoBACP. And again, if you have further questions, please email us at bacpoutreach@cityofchicago.org. Thanks everyone for joining today.